What if makeup can be stripped to its simplest form? Introducing Kiss Mineral. Made in Australia, we create gentle cosmetics that are suitable even for sensitive skin. Embrace the freedom to be beautiful by your own means. Beauty and beyond.
I travel around the world in pursuit of the finer things in life, especially in beauty and aesthetics. In everything I do, I make sure it has a touch of elegance. I believe when your intention is good, people can feel it. In my quest to stay on top of the latest in medical aesthetics, I discovered one of the best technologies in the world, the picosecond laser. The uniqueness of this laser is its patented technology that allows me to treat various indications in just one session.
In my practice, I specialize in treating patients with pigmentation, acne scars, open pores, sagging skin, dark eye circle, and with Piccolo, I can treat all this.
Hello! Hi everyone. I can see some of you are here already. Hello, can anyone just say hi? Anyone just say hi? Oh, I have seen some of you has already come to the class, come to the room. Probably can you type, first thing first of all, I would like to double check with you guys. Can you hear my audio clear? Because we put the mic here. Is the audio clear? If it's clear, probably can just type hello. Hi Manjit Paul. Hello. What about the rest? I can see Amanda, I can see Jayin, Nicole, and Savita. Hi Makuta. Hi. No Adriana. That's nice to see you all. Hey, you guys come to the right place. It's Kiss Mineral, but it's under Dr. Ginny Klinik. Yes, I came to Dr. Ginny Klinik today because of we're so honored to have Dr. Ginny to share her experience about pigmentation. So even though these 2 days I have a friend who also contact me saying that, hey, I went to a treat and unfortunately because of the treat, I got my pigmentation. That's why I just now clarified with Dr. Ginny as well. Will the pigmentation suddenly come out, or is the pigmentation already there? And when time is right, it just comes out like that. You know? So there is a lot of myth. Even though myself, I was clear one big myth just now with Dr. Ginny. I thought from superficial pigmentation, it will get worse to deep pigmentation. Unfortunately, it's not. It's actually the other way around. I was like, means that all the time when my treatment is not right. Then because I have deep pigmentation, which is you guys couldn't see it here because it was treated by Dr. Ginny already. Okay, I can see Nofaiza Abu Bakar. Hi. I can see Glory, Mary, nice to see you. Oh, Makuta is clear, my audio is clear, that's great. Since my audio is clear, I would like to, that's great, Savita, I saw it, you said it correct, okay, thank you. Since you guys can hear correct, and then you can hear me clear, and before I put Dr. Ginny come in, do me a favor, share to your friend. Is it possible? Just share it to your friends because I think today's topic is very, very, very good for a lot of ladies out there. We thought that we put sunscreen, we will not have pigment. We thought that we take care, we take umbrella, sure will not have pigment, correct? And we thought that some of us, we have pigmentation since young. We thought, no, this is gene. Actually, all these can be taken care of. Yeah, and to be serious, I'm so happy to have Dr. Ginny. And you know what? It's not only one time. You are going to have 6 series, and just now, Dr. Ginny said 6 series tak cukup eh. Isn't it good news? You know, sometimes we were not in, you know, sometimes we want to ask something which is professionals' advice, but we feel that so embarrassed, or if I go into the clinic, they will charge me very expensive. Actually, all these are wrong. Yeah, this is not right at all. In fact, we need to come into the right clinic to ask the right person to have the right treatment to treat you correctly, rather than use someone here, my auntie said this is good, my friend said that is bad, you know, then I don't use. And my friend said this sheet mask can lighten up my pigmentation. And my friend correctly lighten up, but how come when I use that it become worse? Do you have this kind of questions in your mind and you don't know who to ask? All right. So while I'm still talking, you know, I really wish that you guys can just help me to click share to your Facebook page or any close group or big group that you think your friends really need these kind of questions. Then probably we can invite them to come in and share with us the session today. And those who are coming here, please don't go, because why? I forgot to share this. I want you to see. Stay tuned to be one of the 5 winners. 5 selected winners will take away 168 ringgit cash voucher for laser treatment, of course, with TNC. Okay, so if you have more questions want to ask from Dr. Ginny, that is the call number, and you can visit Dr. Ginny clinic. This is the second branch beside Alor. This is the second branch in Taipan. You know why Dr. Ginny comes to Taipan or Klang Valley to open up her second branch beside Alor? Why not Penang? Why not Butterworth? Why come to Klang Valley? Do you have this kind of questions? I do have. When I know she's coming here, I was like, why Klang Valley? You know, because all the way from Alor to here, firstly, the distance is long. Even though, yes, now we can take flight, but the thing is, like, she needs to prepare herself to come all over from Alor to stay here for a few days in hotel, you know, then have to pay focus for the patients. I think, to me, it's not an easy job. I do, of course, before MCO, I do travel business trip to nationwide. I feel it's very tiring. So that's why I always salute. Every time she comes to Klang Valley, I always say, how are you, my dear? You know, have time for dinner or something, because I know that it's a very lethargic or very tired when she put all her focus into her treatment. Okay, and of course, this lovely Dr. Ginny, I know her since I think 200 when Kids Mineral started. Not so long. We started 207. Yes, 2009. I went to her clinic, and I tell you what, from 8 o'clock morning when she opening, from 8 o'clock morning I do makeover until 8 o'clock at night. 12 hours. She break my records. Yeah, she break my records. And Dr. Ginny is a very, very lovely person, very warm and very. What to say in Mandarin, we say "要稳我，要滴我滴." Means to say, if she promise you this treatment can be done 50%, it's 50%. Yeah, if this treatment can be done 95%, it's 95%. I think this is important as my experience. You know, I have heard a lot of my friends say that, hey, you see, doctor is good, but when I went there, they only want me to sign up package. And when I my treatment doesn't go well, they tell me to switch package and then top up money again and again. But I refer so many friends to doctors, Ginny. So far, I don't have this complaint. I don't have this complaint. I hardly refer customer to one of the clinic unless the clinic is really good. Okay, and you know why she comes to USJ? Because she is a trainer by she trainer in laser, trainer in fillers, trainer in Botox. You guys must know to appoint her as a trainer means that she is best of the best. Then only she can train the rest of the doctors. Okay, so that is how wonderful how glad I can get Dr. Ginny comes to our series for Kiss Mineral. For Kiss Mineral customer, I always heard that a lot of you asking, hey, Kiss Mineral can cover my pigmentation. Can it lighten up? No. Unfortunately, pigmentation is from inside out. Yeah, Kiss Mineral is outside, which is a cosmetic product, toxic free, safe makeups. Yeah, you guys come in just now, you can see that the brand story, right? So that's why since 2009, Dr. Ginny has been using Kiss Mineral until now. Wow, more than how many years? 12 years. 12 years. 12 years. I can't believe time flies. All right. So, you guys want to see Dr. Ginny or not? Or let me talk for 1 hour? Because I have the slide already. You guys want to see Dr. Ginny or not? If you guys want to see Dr. Ginny, please type there. Welcome, Dr. Ginny. Why not? Taiwan very convenient to visit. Yes, Manjit. I'm thinking to. Okay, let me show Manjit call. I'm thinking the same. Maybe the clinic we charge more. So most of the time I avoid to give a visit. From now on, you have an option. Manjit, you have an option. You can come to Dr. Ginny. If Dr. Ginny treat you not good, tell me. Okay, I'm sure you will laugh out because you can hear her voice is keep laughing already, right? Yeah, so that's why I think I don't want to delay because it's already 12 minutes. Today we have about, let's say, if you guys have no question, we will off early. Then I can go off early for buka puasa. Then if let's say you guys have a lot of questions, we don't mind to stay. Okay, we don't mind to stay. Answered all your concern. All right. All right. Last but not least, please welcome Dr. Ginny.
Wow.
Hello. Hi, Dr. Ginny. Seriously happy to see you.
I'm just so honored. Yeah, after the 13 minutes introduction, now I'm very stressful. Okay.
Now my job off already. I was so stressed just now.
Oh, yes. Then you pass all the ball to me.
Yes,
so smart. Okay.
Okay, this is Dr. Ginny. Yeah, both of us have the same surname. We are 001. 001, James Bond. OOI. Okay, Oi, but not Oi. Grace Lee said, hi, doctor.
Hi, Grace Lee.
All right, that's great. Is that your patient? No, is it?
I think so.
If let's say you are doctor's patient, can you please say hi to doctor? And you know, now she is in Taipan right now, so I think it's quite good to say hi to her to reduce her nervous. I also
nervousness. Okay.
Yeah.
She do lives every day. I think this is only my
life.
second or third life only. Okay, so I'm more stressful. Okay. She do very well. Yeah, after the introduction, I become more nervous. I think you mentioned a lot of things just now. So shall I answer all the things?
Okay, maybe we can ask the group. Okay. What I can say is today's objective is actually talk about pigmentation. Okay, if you have a scarring problem or you have acne problem, we still take your question, but we will answer the next few series. Okay. Yeah. So today we will talk about pigmentation. Who has this always thought that pigmentation name only freckles?
Yes.
Right?
Do you think a lot of times because the patient will come in and then show me their pigment and say, doctor, please treat my freckles, please treat my freckles.
You know what is freckles? In last time when I studied in Australia, they love my freckles because why? Under the sun, they see the bintik. They said, "Wow, it's so lovely to have freckles." Then I was so proud, but actually it's not. It's become darker. It's become today when Dr. Ginny told me that my pigment is actually very deep and it's not easy to get removed. Yeah, so I was like, you know, but a lot of customers, they thought that when you see one little dot means freckles. Actually, there is a lot of different things beside freckles, superficial pigmentation and also deep pigmentation. Yeah, when we later we will mention the name. You will, what is that?
I try to make it simpler and easier for you all to understand. I'll show you all a few slides so that you all can actually differentiate among different types of pigment. Like what Chris said just now, actually freckles is a very good market in Malaysia, but actually my European friend and my Australian friend just said that they got no market there because people there actually like freckles.
Oh, really?
Especially Australian. They really like the freckles. They are proud of the freckles. So they do not want their freckles to be removed.
Oh, no wonder last time when I really have the freckles, they really tell me,
Yes.
"Hey, you look so cute." And
Yes.
I was like, okay.
Yes, they really love it. And then they are proud of it. So actually we have a few like branded laser, which is good to remove pigment, but then it's not sellable in Australia. Because Australian, they actually love their freckles and some of the pigment.
I see. Okay. What about the rest of you? Shall we start to show our slide, or you guys want to have a chit chat first? Yeah, like today, Teddy, like Saul, is it Dr. Saul or Amanda, Nicole? Any Savita, do you have any questions that you want to verify? With no questions, okay, no problem, no problem.
Yeah, Savita has seen me before already.
That's great. That's great. That's great. Okay, most probably we can. Okay, give you love. Okay, probably we start slides.
Yeah.
Maybe we can share.
Go through the slides.
Go through with you the slides.
Alright.
Okay, share slides.
Yes.
Okay. Can you see the slide? Can you see the slide?
What do you call it? It's like small.
Okay.
Okay.
Okay, can you see the slide? Yeah. Okay, that's good.
So, but you have to go to full screen.
Sorry, first time.
Okay.
Are all the pigmentation the same? This is one of the questions. Just now, like what we said, is it what you say? Is it freckles to represent all pigment?
Yeah, because
wait, can you guys see the? Can you maybe see? Wait, so sorry. I think only this.
or maybe you have to stop and then start again.
Yeah. Self-introduction.
Cannot do full screen.
Because of unless I do this.
I do full screen.
Just hang on, some technical issue. Some technical issue. Can you guys see the screen?
No, it's not running. It's not running.
Probably if like that, it's all about
How to go to next one?
Sorry, first time. Sorry, apologize. It's not I stop the screen first. So sorry. If let's say we just continue conversation, is that okay?
But they can't see the pigment all that.
I can show the picture.
You put full screen and see.
So sorry.
It's okay. Let's see how we can solve that out.
Just 1 minute, yeah. Share.
Okay. We cannot put full.
Okay, this basically that's how freckles look like. I can. Hello, good evening, Ginny. Hi, Adila. Can you see the freckles? If I say just only this, is that okay?
But how are we going to run the rest of it? So if you see, it can go, okay. Then we do a small one.
Wait. Okay?
Yeah, at least you can see.
All right,
okay.
so
we go
yes.
up.
We go up, which is the freckle superficial. Okay, so sorry for technical issue. Let's see, all pigmentation are the same?
Yeah, of course it's not like what I mentioned just now. Yeah. So let me show you a few pigments, the common superficial pigment. Because for pigment, actually, we have superficial pigment and deep pigment. Okay, so today I will basically focus on the superficial pigment. We will have the next session whereby we will focus about the deep pigment. So the superficial pigment, there are a few common ones: freckles, the age spots, the capital spot, and the epidermal melasma. So okay, let me show you the freckles first. Okay.
I think these freckles seriously look really what do you say that? Really lovely. In fact, but not too much lah. The second one is a bit too much lah, right?
Yes, because the freckles actually is very common among like light skin people, and then it's actually like inherited. So there is genetic predisposition. But of course, sun exposure is still one of the main cause which causes the freckles. Why people in Australia they will have more freckles is because in Australia there is a leakage in the ozone.
Yeah.
So the leakage in the ozone actually will cause more like sun damage to the skin. So therefore they have more freckles.
Okay. Means that if let's say one day I only go out like 20 minutes driving, really harmful enough to our skin?
Yeah, if 20 minutes without any sunscreen, at the peak hour of the sun between 10 a.m. to 4 p.m., that is good enough to get sunburn. So just now you mentioned that you have friends actually went for a holiday and then you have the sunburn, the pigmentation. That is because of the sunburn.
Okay.
So you have to understand actually the pigment formation after the sun exposure actually is protective. It actually, the pigment actually is like shadow on your skin actually to prevent further damage. Meaning that prevent further like sun penetration into the deeper part of the skin.
I see.
So there is actually protective to your skin, but it's just that we do not want that. It doesn't look nice.
Because a lot of friends of mine, they are very lazy type. So they will tell you that it's okay. I just go out, tapa, and come back. You know, very short. And I only apply sunscreen when I am going out under the sun. Then only I apply sunscreen. So means that all this mentality is not correct.
It's not right. Okay, you have to apply the sunblock half an hour before you go out. The sunblock is not that immediately you apply, immediately it's effective. It's not. You need at least 30 minutes.
Unless they are using brush and block.
Oh, yeah, you get the point, yes, unless you using brush or block.
That
Yeah.
is the main point, okay?
Yes,
That
yes.
is the main point that I want to bring up. No, actually, no, because that is, I mean, a lot of liquid sunscreen, the reason why many customers not really want it, because you need to wait, you need to, make it as a habit. If, by applying skincare regime, you already need to apply the sunscreen so that your skin is fully protected. Even though you only go out for short periods or you only at home, because now a lot of people work from home, right? So that is the basic regime that everyone need to have. Can I say that?
Yes, definitely.
That's great. Okay.
Okay, there is freckles. So how about age spot? This is very, very common among our population as well. So you have one big spot there. So sometimes actually you can't really differentiate whether this is benign pigment or is malignant, especially if only one spot. So if you are worried, I would advise you actually to consult a doctor to say that whether it's a benign, meaning that it's non-malignant, benign spot. So this one we can treat easily with the laser. If the age spot is like recently becoming very big and then there is changes in color, then you feel itchy or there's bleeding, then you have to be highly suspicious of malignancy. So actually, it is not easy to actually master the diagnosis of pigments. So not all doctors can diagnose properly. So you need to actually go to a professional doctor who actually have the experience to diagnose properly. Oh, this is only the benign age spot, and then I can actually treat it with laser without any problem.
Okay. So, wait, there is one customer named JC Chong. Shall we answer her questions? Dr. Ginny, from
Yes,
Klinik-
tranexamic acid safe to be taken to treat pigmentation. So that depends on which type of pigment. Thank you very much, JC. Okay, tranexamic acid is widely used in Japan to treat melasma. So Japanese actually they have studies showing that tranexamic acid actually can reduce the underlying vessels that feed the melasma. So it is very effective for melasma, but not for all types of pigment.
Melasma is light superficial.
Okay, melasma, very good question. Melasma can be superficial, can be deep, and can be mixed. Mixed meaning superficial with deep component. So melasma is a very, very challenging pigment to treat because it's like a chronic pigment disease whereby you actually have very high sensitivity to sunlight. So every time you have sun exposure, easily for you to get the melasma flare up. So melasma patient actually they need to be on long-term actually sunblock, moisturizer. They need to avoid any like irritants such as the acids, such as the skincare with a lot of like chemicals or that, which will actually irritate their skin and cause the flare up of the melasma.
Now you know why we need to see doctor, right? Rather than you hear your friends say, I hear my auntie say, a lot is like wow, I really get a lot of points from Dr. Ginny today. So yeah, please carry on.
Okay. So age spot can be treated with laser. So this is cafe ole spot. This is superficial pigment.
This is not cafe, It means that you're not going to cafe and get this spot, It's actually the name of the spot name, cafe ole spot. Okay.
Yeah.
So because just now Dr. Ginny was saying that I couldn't find another word to replace it. So otherwise we call it CAL.
No, coffee spot.
Coffee spot. Oh, no coffee.
Joking.
Coffee lover will be very nice. They will put their ear up already. Oh, coffee spot.
This is not caused by coffee, definitely.
Okay.
This is one type of birthmark. But this birthmark is a bit special. It is not necessarily to be present at birth. Yeah, it can be hidden at birth. Then during your teenage time only it like come out. Yes. So this cafe ole spot is actually red, although it is superficial, but it cannot lighten with creams or that. This one definitely need to do laser. But the second message is sometimes actually patient doesn't know that this one can be treated. Yes. So actually, I feel very happy that actually Kids Mineral, they actually have the initiative to do this series of like education video live, so that actually more people can benefit. They know, okay, oh, this type of treatment can be treated. Oh, this one how to treat. Whether this one can be treated with cream, this one you need to see doctors for laser treatment.
Yes. The reason why I get Dr. Ginny to come in, and she is so open, and she is so what to say, that she not even think for seconds, okay, can we do live, so I was like, wow. Then someone is like, hey, I got a lot topic to talk, then because I told her that a lot of customers is asking some of the more professional questions. You need professional to answer rather than Kiss Mineral to answer. So that's why I said, then we must have more. Then they said, okay, 6 series. Then we look into it, it's like, no, I think I have more series to come. So unless you guys are supportive, otherwise, it help us to share to more customers, so that we can
Benefit more
people. And you know what, doctor even fork out the voucher 168 for those during the commercial break. We will have a question to ask, then those lucky 5% we will select you. So stay tuned, and all these questions it's come from the just now what doctor has mentioned. So that's why you guys have to pay attention. Right?
Don't play. Pay attention. Okay, we go to the next treatment. So this is extremely common. Okay, this is epidermal melasma. Okay, melasma, some people will actually call it like butterfly pigment. Yeah, it's actually most commonly like appear at the both cheek, then it actually connected through your nose, so it becomes like a butterfly.
Okay.
Yeah, so melasma is very common. So I will briefly talk about the causes of melasma. So melasma causes, yes.
Before that, this melasma is only for mostly lady is the patient, or guy also have?
Oh, you always ask me difficult questions.
Got difficult, lady or woman or man only ma.
Okay, melasma is more common in women just because melasma actually have hormonal predisposition. Yeah, so woman is very beautiful. Okay, they have menses every month, and then every month the menses actually will get your melasma become darker. Because your estrogen hormone and progesterone hormone in your body actually can get more pigment formation, especially if you are having melasma problem.
Wow, isn't it a good question? I mean, like, that's the reason for us. We need to spend the right place, to know what is actually, rather than why period before period I get more darker, why after period I get lighter. At least now with her 2 sentences, it's clear up all my doubt already. Okay, continue.
Yeah, so the external causes, the common external causes will be the sun. Okay, the first one is the sun exposure. Second is dry, injured skin. Because when your skin is cracked and dry, so the sun actually can penetrate deeper inside and cause more pigment formation. The third one is skin irritation. Like just now I mentioned, if you use the improper skincare or use the improper makeup, okay, or you do the improper treatment, you actually get the skin irritated, and then your skin becomes thinner and then more vulnerable to pigment, especially melasma. Yes.
Okay. Comes to makeup, right? So that's the reason why for Kiss Mineral, until today we are still hold on a bit. We are not going to compromise to add in any synthetic color. That's one of the reasons why. Commercial.
No, you are genuine in saying that. Okay. So the internal causes of melasma will include, like what just now I mentioned, a lot of the factors here are actually hormonal related. The first, of course, genetic. So if your like family member have melasma, you tend to have like more risks of melasma. Okay. Then secondly will be hormonal pills. So those taking like contraceptive pills or hormone replacement therapy after menopause, you actually have higher risk of melasma. So during pregnancy is another peak of melasma, especially if underlying you have the genetic of melasma. Maybe before pregnancy you you have been taking great care of your skin, enough sunblock, enough moisturizer, so you've got no problem, no melasma. But once you're pregnant, with the hormone stimulation, then you will get more and more melasma.
Then after delivered, will it can become normal back, or it will be become, or as melasma is there, it's already continued there?
That will depend on your luck. So some, if your melasma genes is not so strong, probably like during melasma you have to flare up. Then if you are taking good care of your skin during the 9 months of pregnancy, good moisturizer, good sunblock, then you do some like maintenance facial, then okay, maybe 6 weeks after the pregnancy, after the delivery, then your skin back to normal. If you're not taking care during the pregnancy, then if you are not lucky that your genetic like influence is higher, then probably that will become permanent. Then you need my help. Come for treatment.
This is really unfair as a lady, right? It's like because of a lady, we get pregnant, we thought that to have to complete the reason why to set up the family, all this, and then we take extra risks like pigmentations, like what to say that if we lucky, if you will get it off. If it's not lucky, after delivered, it become permanent, right? So that is not that's not right. That's not right. Okay.
No, the world is always like that.
So far, how's things? I mean, how's everything here? I mean, for the viewer here, do you have any questions more to ask? We will feel more
than willing,
more than willing, and we feel more to answer for all the questions. Otherwise, is you guys continue. We just continue give more information,
and then you fall asleep.
Yes, important you fall asleep. Okay. Probably we go for another few more slides, and then we will go for a break.
Yeah. This one very special. The commercial break one. Just now she told me got commercial break. I said okay, it's like commercial break. This is the first time I attend live session and then got commercial break. So okay, like just now I said okay, pregnancy. Then another unfair thing is menopause. Okay, so because during menopause you actually have hormonal imbalance, this can actually trigger a melasma. Okay. Of course, stress also. Why? Because stress actually will stimulate the MSH. MSH is melanocyte stimulating hormone. What is melanocyte? It's the things that will become melanin and then the pigment.
The color.
Yes.
The color. The
black color that we do not want.
Yes, is in our DNA.
Right? Yes.
So the color, yes.
So reduce stress, okay, women down here, okay, please reduce stress because the stress actually can trigger all your melasma.
Especially nowadays, when this MCO comes, everyone, even though yes, it's work from home, I find that when I work from home, I am more stressed than work from office. This is what my personal.
A lot of patients also feedback that.
Yes, so that's the reason why. I mean, as a lady, I think we must have more reason to love ourselves so that our stress level will go down, and then we will less have a risk of to get pigmentation. That's very, very important. Okay, let's hear from Dr. Ginny few more slides, then we go for commercial break.
Yeah, I want to emphasize this. Self-love is very, very important. Yes.
Totally agree with that.
Yes. Okay, so the correct diagnosis is the key to successful treatment. Like what I said, not all pigment are freckles. Okay, then different treatment actually need different treatment. Okay, so what are the basic treatment that I can share with you all? The first, of course, like I say, lifestyle modification, stress control, okay, and adequate sleep. Because when you have not enough sleep, also you will stimulate the MSH that I mentioned just now. Okay. So you need to have a proper sunblock, ideally SPF 50 and above, if possible, to reapply every 4 hours. Then you need to have adequate skin moisturizer, because when your skin is dry and cracked, then it actually will get the sun to penetrate deeper. Okay?
All right.
Yes. Then of course you can have some skin supplement as well. Yeah.
Supplements is also important, I guess.
Of course. So supplement like vitamin C, okay, like some detox vitamin, all that is very, very important for to maintain pigment-free skin.
If let's say the person not willingly to go for laser treatment,
Yes.
then if by only using
Put kiss mineral.
that's important. But what I'm trying to say that because some of my friends, they are actually very worried about laser. Definitely for those friends, Ginny, I saw you here. Cheng Ji, I saw you here. Beryl, I see you here. Leong Chi Hing, I see you here as well. Lisa Hamid, thank you for joining in, Lisa. All these because I want you to stay tuned. The reason is Dr. Ginny is very specialized in laser treatment. Yeah, and I wish you are one of the winner who take away the 166 voucher. Okay, so don't miss this. Stay tuned. And because Dr. Ginny is, I said when we started, she is one of the famous trainer for laser. She trained doctor, no, not doctor trained her. She trained doctor. So you guys must stay tuned and know what is the myth. I don't go for laser treatment. Then what about my pigment? You still have optional supplement.
Supplement. You can't think and give you magic supplement. But that can only lighten the melasma, not the freckles, not the cafe au lait, okay? Yeah, all that still need lasers, please.
I think most of these supplements are not say wait until the melasma come out. We also prevention,
Yes,
correct?
prevention is always better than cure. Okay.
Yes, that's great.
That's great. Come, next slide.
Next slide.
Okay, sunscreen. Okay, we skip this. Don't need it. Just I mentioned SPF 50 and above for hourly. Okay, so sunscreen option. Okay, you can those with dark color, with pink color, or with beige color. So we have different colors, and of course we have the brush on block.
The first three is actually Dr. Ginny's product, and the last one is my product.
Commercial break. This is commercial break.
The reason why we put this is actually for you guys to know. Not you no need to change all for now onwards. Means that if you come to Dr. Ginny's clinic in Alor, if let's say you are in Alor, you can look for Mediskin clinic. If you are in USJ, you can come for Dr. Ginny's clinic, where you also under Mediskin as well. Why these two sunscreen works better? Because of you can reapply the brush and block anytime, anywhere. All right, but because can I ask a question to all of you here? How many times you wash off and you reapply every 4 hours? I didn't. I never do that as well.
My patient say cannot. That's why I ask them, okay, if you have makeup, then you cannot reapply. If you already have makeup, you cannot reapply the cream sunblock. So you have to use brush on block. Brush on block is SPF 30, but it's good enough for you to actually to brush on. So I ask my patient to actually, with SPF 30, you need to reapply every 2 hours.
Yes.
No more 4 hourly. You have to do more tedious work. Every 2 hours, reapply your brush on block.
Yeah, you can come to Dr. Ginny's clinic to get brush and block. Okay?
All right. Then okay, we quickly go through a quick slide. The moisturizer, you need to be careful when you choose the moisturizer. You need to check there is no acid, no lactic acid, no ascorbic acid, no citric acid, no salicylic acid. Because the skin actually wants adequate nutrient. The skin actually doesn't want any acid. Okay? The acid actually will injure your skin more, and then you cause all the dry and cracked skin. All that will actually cause more pigment.
I see.
Yes. Okay, these are a few our in-house brand of moisturizer. This one all is approved by Ministry of Health.
Yep.
There is no chemical, and that is safe to be used for long term.
This is important because a lot of customers, they are actually looking for immediate product. When I apply, it must be moist. My skin can be Cinderella skin tomorrow already. But a lot of customers, they don't understand when they come, the result comes fast. Essentially has a lot of high technology inside the product, especially like whitening agent, right?
Yes.
So that is the reason why if you can't wait, then you go for those who promise you faster result. But when you see the pigment come out, why suddenly all come out? All this relates to your skincare as well, to be honest. Yeah. So when it comes to choose the right skincare, it's always good to get a professional. you know, or someone that who has already sell skincare for long, like you know.
Yes.
No, just joking. Okay. So yeah.
Yes. Okay. Then we have the medical treatment, because like what Chris said just now, not all patients are like ready to do lasers.
Yes.
There's a lot of myths, but I will clear up all your myths later. Okay. So if you really say no, I don't want any lasers. Okay, it's okay. I respect your choice. Okay, we have medical treatment for that. Okay. So the medical treatment for pigment, you can actually use the hydroquinone or azelaic acid, kojic acid, licorice extract, or retinoids. Okay, so hydroquinone is medical grade, azelaic acid is medical grade. The rest of them actually is cosmeceutical grade, meaning that you can get it from outside skincare.
Okay.
Right. So if you are looking for like non-laser interventional treatment, we can provide you some choices as well. We got microdermabrasion, which is like we have our co-facial aqua pill, can actually like remove all your dead skin and get your skin become more like even skin tone. Okay, the aqua pill is actually our best seller here for non-laser interventional treatment. Okay, now of course we got our chemical pill. So chemical pill have various content. It can be glycolic pill, it can be salicylic pill, mandelic pill, or TCA pill. So of course, various skin condition needs different pills. So doctors will actually assess a skin condition, then we will tailor make which chemical pill actually suits your skin.
This is very very important, because a lot of outside, I mean, I shouldn't say like physicians or something like that.
Can you just say?
I just say, right?
You just say the fact.
I mean, this is the real fact, because there is a dermatologist who actually told me, I hate when people come to me because of the beautician say my skin outside is dry, inside is oily. Where got such thing? I said, I don't know. Because we always hear someone here sounds very logic, but actually it's not logic at all.
Yes,
right?
Yes.
So the skin is very, you know, skin is our biggest organ in our body, the largest organ.
Yes,
right?
Yes, you are right.
So that's why when skin gives you some swollen or redness, it's actually telling you something.
Yes, you need to be alert.
Yes.
Red alert.
Correct. So that's very alert, because why? If you overseeing this, that's where it comes the pigmentation, where the skin becomes dry, fine lines, wrinkle all come together. All right. So that's where then only you say that the moisturizer not change. But actually you must know what is already the skin has already fed back to you. Then this is only doctor can tell you what, hey, your skin is now is this condition already. You see your skin, you can see all the red skin, allergy, the
so I will know.
right?
I will know when I see all the vessels. So I know you have been using some skincare with acid content. So your skin now is very very thin, and then it's very vulnerable. Then we will do the soft laser treatment, which actually can regenerate your skin, at the same time lighten your skin without causing any injury.
This is very important, because of many of those close to my friends, usually when they see me, the first thing, Chris, what do you think about my skincare? I was like, no skincare consultation. Why you ask me? No, because you have this. But to me, to all of us here, important is to read your label. If you don't understand your label, ask the right platform to be solve all these doubts. You know, whether am I invested 1,007 is correct, you know, 2,000 is correct. 2,000 is not, it's just only money, but 2,000 must give you the right result, rather than turn to you need to spend 20,000 to recover. That is very even hurt. All right, so any more?
I think probably the lasers. Okay, then for interventional treatment, we actually have various lasers for different types of pigment. So I think we no need to mention all the lasers. So because the professional doctor is the one who actually plan out the tailor-made the treatment plan for you. Okay. Then now come the myth. Is laser treatment mandatory for pigment? So a lot of time they will say, okay, I don't want to do pigment, I just want cream to lighten it.
Because my friend told me after laser skin very dry
and very thin.
Very thin.
Yes.
Yeah lah, the person tell you is right, but she only hear half part, we didn't hear the half part. So that's why to me always is like, no, you have to understand the whole process rather than hear someone say and someone only hear her friend say and her friend only hear her friend say.
Yes.
Oh, that's terrible.
So that it becomes myth law. So we actually have different treatment protocol for different type of pigment. Okay. So actually treatment for superficial pigment that we focus today, like some pigments such as freckles, age spot, and cafe au lait spot. Sorry, this one definitely laser treatment. You don't need to waste your money to buy the pigment cream. Okay. So the pigment cream will help you for that. Yes, won't help you for that. Okay, you don't waste your money. Of course, we can do chemical peels to increase the skin turnover for the better result of the lasers. Okay. How about other pigment, like how the pigments such as the superficial melasma, the superficial PIH, or sunburn? Okay, if it's still early, you can actually use pigment cream or chemical peel to lighten it. Okay, so I show you a few of my experience for, I think, just a quick one. Okay, the freckles. Okay, this 23 years old girl actually have pigment since secondary school. So freckles is very pertinent history. It started since secondary school. So this patient actually tried the pigment cream online, but got no effect. So this is the common lah. Okay. Also, I started her on the picosecond laser with the triple formulation. So I show you some results.
Wow.
So this is after 3 treatments. Why only 3 treatments can almost clear? This is about 90% clearance. First, because she hasn't got married yet. So no delivery. Okay, because each pregnancy can actually worsen your freckles and become more difficult to treat. So this one can actually, before the pregnancy, actually the treatment is easier. So 3 times, almost 90% clearance. So for the age spot, the scientific term is solar lentigo. Okay, so this 52 years old lady has slowly progressive solitary pigment for the past 20 years. So it's slowly progressive.
I have a lot of friends like that.
Yes, it's very common. And then this time you need to be careful, because if it's only one pigment, you wouldn't want to miss the malignancy. Okay, so you need to ask the patient whether there is sudden change in the size, there is sudden change in the shape or color, or is there like any bleeding or painful. Okay. So if there is this characteristic, then you probably need to do a skin biopsy to rule out malignancy. So if there is no sudden change, it's slowly progressive, then you are confident as just a normal age spot, then probably you can do laser to get rid of that. Okay. So this is after 3 treatments. You can see the whole thing actually almost cleared off.
Now you guys know why. You see, doctor treat directly to the root of the problem. If she doesn't jump into, oh, you want to lighten? Okay, I lighten for you. You know, she didn't do this. She must know why. What is the root of the problem? I think that is the reason why by only 3 treatments you can see so impressed the result already. Actually, there is one customer is asking questions. Probably we can refer. Okay. This is the customer. Hello, hi, Ku Kim Kia. I have a question. If a liquid sunscreen SPF 50 has been applied on the face and then Kiss Mirror powder foundation 24 is then applied on the face, can it be considered that SPF 50?
Yes, it's SPF 50. Okay, I know what you want to ask. Is it whether like 50 plus 24 becomes 74, right? It's not. It's not. You only take the highest number. So if you already have a liquid sunscreen SPF 50, then you put the foundation, so it's still 50.
You have asked a very good question, Kukin Kia. You know, I have a friend also asked me, you have 24 already, and brush about 30, so 54? So, and then,
it's only 30.
And not only this, I applied 3 layers of SPF 30, SPF 90.
No such thing.
We wish to. How we wish, but I'm glad to hear at least you guys apply 2-3 layers of sunscreen. Therefore, at least you know you start with SPF 50. You know, so then this is I think this is important to have a habit of sunscreen, especially recently morning sun is so big.
Now it's very strong.
In afternoon, summer is really bad. Yeah, but it's really appreciate your questions. For the rest, if you have more questions, please feel free to come in. And we are over time, you know. We still haven't come up with.
I still have another 20 slides to run through.
Serious?
Okay,
So sorry. Is it?
No, I think we go up. Yeah, I think this one. Yes, this one done. Okay.
So we will go through a little bit fast.
Superficial melasma. Okay, this 46 years old lady actually previously treated in 2017 and then come in again in 2019 for recurrent melasma. Guess what? She actually accompanied the daughter to went for a beauty salon treatment. Then they actually recommend her to do a don't know what treatment lah. So she said that something apply on my face, and then the coming morning, my whole patch of black pigment come out. Then she come to my clinic, almost want to cry already. Yeah, she's a teacher, so that time is during school holiday. I still remember it's December. So during school holiday, she said that school want to be open already, doctor. Can you please help me in 1 week time to clear all my pigment? I said, I cannot. I'm not a magician. I cannot straight away remove, you know. So I do try my best. Okay. So she previously actually treated with the precision anti-age laser and yellow laser. Then she actually would like to try new technology at that time. So I started her on a picosecond laser and with the oral tranexamic acid. Okay. So I managed to help her. After 2 times of picosecond laser, you can see almost cleared 90%. So she is quite happy, but I think I just managed to do it after 2 months.
The whole face texture also has been improved.
Wow, your skin is so sharp, this.
Wow.
Yes, because I'm doing not only the pigment, because our picosecond laser, we can do 7 indications in 1 session. So it's a 7 in 1. The first is for brightening. Second one is for controlling, lifting your jawline, lifting your nasal and pupil. The third step is for the eye lifting, okay, to tighten your skin surrounding the eye. The fourth indication for your pores. That's why you can see the pores actually improve. So the fifth indication is actually for pigment removal. The sixth one,
some more 6 lagi 2 treatment. Come for 1 pigmentation. So much improvement.
Yes.
睇到爛啦。
睇到爛. So the sixth one is for reducing the redness. The final one, I can even treat the depressed scar with this picosecond laser. So you can see actually, a lot of my patients actually, they can observe that the skin become tighter. Okay, then their skin tone become more equal, and then their pores become smaller, and then their pigment, the depressed scar actually improve. So they can get 7 in 1.
This is fantastic.
So she is really extremely happy. Okay,
I see this. I also happy.
Yeah, I'm happy to.
Imagine her skin put on kiss mirror. Wow.
Yes. Wow effect. Wow
effect.
Yeah.
Okay, case study 4. Okay.
So the fourth case is melasma as well. She's a lecturer. She never done any laser before, so I'm very extra careful for her because I want to try something like mild for her and then won't scare her away, you know. So I combine the picosecond laser together with my another like bright and smooth laser together with my dual yellow laser. So you can see 2 weeks after 3 treatments.
2 weeks
after 3
14 days, 3 treatments. This is very good.
So you can see the whole face actually the color become lighter, the pigment is better, and then you can see actually the pores is better. Then you can see the glow, right? Right. Then you can even see actually the skin is not so saggy.
It has been
lifted a bit. Lifted a bit. Okay, we need to go a bit faster already. Okay, the PIH, post-inflammation hyperpigmentation. Okay. This patient 55 years old, sudden onset hyperpigmentation after patient in beauty salon. She actually a patient in Alor, in Bukit Penajam. She traveled all the way 120 kilometers to my Alor clinic actually because recommended by friends. Okay. So I started her on the laser, 2 types of laser, then with the tranexamic acid, okay, and the triple combination cream. So this is how it goes. So after 1 treatment, it become like this. After 3 treatments, you see so much better.
Wait, you guys, for those who are still here, seriously, you guys need to share this out because of not only sharing
sharing is caring.
Yes, sharing is caring. Second thing is important because of this. You guys have seen the case study, and those are very common and
Yes,
and
very
it still haunted our surrounded family. Haunted. Hey, do you think when we wake up with this pigment on the cheek, I don't feel good, right? I don't feel good, and you know, to do conceal all this is actually a pressure in the heart.
Yeah, true. That's
Right.
right. I always tell my patient actually, although makeup can actually hide your pigment, but you can't wear your makeup and sleep, right?
Yep.
So you still need to have your real face to face your family member,
yes,
your close one,
yes.
your loved one.
Yes.
Of course, you want your skin to have like a natural glow without any pigment, right?
Yeah.
Okay, this is after 3 treatment, right? So, okay, the next of laser. So, can laser cause cancer?
So
Yes,
I think we go for a commercial break.
Yeah,
Then we come
sure.
back for the meet.
Yes.
Is that okay?
Sure.
You guys okay with commercial break? If yes, just type yes. Is that okay?
Everybody fell asleep.
Yeah, because I want you to rest a bit because so many good case study and you guys need to digest what is good, why Dr. Ginny can do all this, isn't it? So there is a question during the commercial break. There is a question. All right. The question is very simple, and we will choose the only 5 lucky winners. 5 lucky winners. Yeah. Who can for the first 5. Very simple one. Okay, very simple. If you pay attention, Dr. Ginny just now, I'm not talking to ask you what is the name of the pigmentation because I also cannot remember. Okay, but I want to ask you a question, which is very, very simple question. Beside Dr. Ginny's clinic in USJ, okay, where is another branch? Okay, for those who has answer, please come type now, and we will come back.
To me, Kiss Mineral Makeup is actually 100% pure mineral makeup without any chemical. So it is very safe to all types of skin, especially sensitive skin. I have been using this one for 7 years already myself. I'm using it every day. And then all my patients so far has been giving very good feedback on Kiss Mineral Makeup. For Kiss Mineral Makeup, because of the unique characteristic, I will recommend to actually all customers. But if you say to want to specify to which type of customer, probably pimples patient will benefit a lot from Kiss Mineral Makeup. Patient with sensitive skin, whereby a lot of makeup in the market that causing all the allergic reaction, they probably will benefit a lot from Kiss Mineral Makeup. All in all, it's a very good makeup with 100% pure mineral without any chemical.
Hello. Wow, you guys are fast. 1, 2, 3, 4. That's number 1. Okay, let's see. We have another question, Dr. Ginny, from Vimi. Vimi is my regular customer for Kiss Mineral, and she always supports Kiss Mineral so much. Thank you, Vimi, for coming. Never be too late, okay? Hi, Dr. Ginny and Priscilla. I came in late. We would like to inquire if pigmentation will resurface after a laser treatment. Will the laser treatment have negative effects on the skin?
Wow, you ask very, very pertinent question. So we run our slide.
Okay.
Yeah, I have a few minutes. We'll clear all your.
Yes. So please stay tuned. Yeah, please stay tuned. For those who have not answered yet, please answer now the questions. If you think that you want to grab the voucher now, okay. Let me share. All right. Vimi, stay tuned because Dr. Ginny is going to answer your myth.
Yeah, so can laser cause cancer? Because a lot of patients will say, oh, I heard we cannot do laser. Laser will actually cause cancer.
Because laser got high radiation. You go in, the radiation will kill your cell already.
Of course it's not. Because laser is the amplification of light source without radiation. There's no radiation. So in terms of cancer rays, X-rays and gamma rays actually are more dangerous. Imagine if the laser have radiation and causing cancer, right? Who will get it first? You do the laser once a month. Every day I do 10 to 20 lasers. So of course I will get the cancer first, right?
But Dr. Ginny is still healthy, okay?
Yeah, the light energy from the laser only remains superficially in the skin. Therefore, it is safe for our body. So just now you also mentioned, okay, after stopping the laser, will the pigment become worsen or resurface like what you mentioned just now? So that will depends whether you take good care of your skin after the laser treatment. Because a lot of patients actually they thought that the laser is a miracle. Okay, after I do the laser treatment, my pigment get cleared, I don't need to take care anymore. That is not the truth. That is not the real situation. You still need to take care of your skin. Okay, so you need to be on maintenance treatment to avoid actually recurrence. So you need to have adequate sunscreen and moisturizer, avoid the improper skincare and makeup, avoid the excessive sun exposure without protection. Also the regular skin treatment to improve the skin healing. Okay. So shall I start treatment early or wait till it is more serious before starting the treatment? Like patient will say, oh yeah, my treatment is like lighter only, then I need to do treatment first. Okay, I wait until it become cancer, then I do it.
Because a lot of things is like, one spot only. Wait until 10 spot, then one price now.
So of course it's not the case. Okay, I'm very fair. And if you have one spot, you only want to do one spot, I can give you the price at discounted price for only one spot. Okay? So it is always better to treat the pigment when it is early and more superficial.
I know you want the best thing, right?
Choose the appropriate treatment according to your skin type, the severity, and the depth of the skin. Okay? So, of course, proper treatment interval is very important to get the optimum good result. So, how to maintain a pigment-free skin? Okay, so the maintenance is very, very simple. Early prevention is better than cure, like what we mentioned just now, the skin supplement, okay, to detox your liver so that your pigment won't come out so easily. Then probably you can have like sunblock and a proper moisturizer, okay. So all that actually is to prevent the pigment. Okay? Of course, you need to avoid the trigger factor, the sunlight, skincare. You need to use the skincare without the chemical acid and mercury. Of course, you need to avoid the makeup with synthetic colors. So this one, Kiss Mineral definitely can help you.
This one only to ask Kiss Mineral will do.
Yes.
Okay.
So of course, you need to avoid improper facial containing acid irritation and also improper laser treatment, which actually irritates your skin. So actually, like what Chris mentioned just now, you need to go to the right place, see the right doctors, and get the right treatment. Right? I think that's almost all. Yeah. Once you noted the superficial pigment, consult your doctor for appropriate treatment. So it is better to treat the pigment when it is early and more superficial, and also adhere to the maintenance treatment. Yeah.
Like just now, what Ginny has asking about the resurfacing.
Yeah.
Is what to say that is it what you get? You got what Dr. Ginny has mentioned just now. You know, like your question, which is we put it here, will the laser treatment have negative effects on the skin? Did you get the answer?
It won't cause the cancer. Okay, first thing, it won't cause skin thinning because we are doing it at proper treatment interval. So you need to get a professional doctor who actually can plan out the proper treatment interval for you according to your skin. Not everybody can do the laser treatment like maybe 2 weekly. Okay, so we need to decide. Okay, so this patient probably they can do it monthly. This patient can do it every 2 weekly. So we will decide what is the treatment protocol for you.
Okay, because we also have private chat where from Savita, she did ask at 6 o'clock 51 minutes, what is the difference between Pico laser second and the Pico Plus, which other doctors are boasting about? Wow.
Okay, because my picosecond laser, here I'm using the latest 4th generation Pico laser, which is Piccolo laser from Korea. I actually tried 7 picosecond lasers, various brands, 7 different brands of picosecond laser before I actually buy this. Why? Because this can actually do 7 indications at once.
Ooh.
So like what I mentioned just now, the brightening, the contouring, eye lifting, pore refining, for pigment, for pimples, even for the depressed scar. So not all people second laser can do that. So some they do the pico class. That is only to maybe do the pigment part. So that one you need to clarify with the doctors. I'm not too sure because different doctors they will have different brands and then they will have different specialty for that.
Yeah, but the important is choose the right doctors who are train the doctor. You know, I think this is important. Thank you, Savita, for your very lovely questions because this is only she can answer because all these comes with the machine specs, you know. And does menopause make the spots darker?
Yes, yes. Pregnancy and menopause is the two most common peak of pigment occurrence because during pregnancy you actually have the hormone stimulation, during menopause also because of the hormone spikes or that because it becomes low and then suddenly you have some hormones, and if you are taking hormone replacement therapy that's even worse, that will actually trigger your pigment formation.
All right. Okay. Amanda Losta. Okay. We have seen some of you has already answered the questions. You know what? The winner we will only announce it tomorrow.
Yeah.
Yeah, we will announce it tomorrow, and as well as if you don't mind, for those who has private chat inside the private chat, and because I scared would get you, is Savita. All right. If you don't mind, can you please just drop a PM in Kiss Mineral message so that we can contact you. For tomorrow, we will announce who is the winner, who are the 5 winners.
Yeah.
We will check the time and then we will get back to you guys tomorrow. We will put a list there. Yeah, Savita, please do a PM in cannot hear. Huh? Serious, cannot hear. You hear?
Testing 1, 2, 3. Testing 1, 2, 3.
All right. Probably can just what to say that. Savita, need your favor. Just leave a message in Kiss Mineral page so that we can private message you. Okay, if you are one of the winner. Dr. Ginny is based in Alor or USJ. Vimin, Dr. Ginny is based
too.
Yes,
I'm based in both places.
She based in USJ and she also based in Alor.
I will come to USJ every 2 weeks. Yeah,
yes.
Then every time when I come, I will stay about like 4 to 5 days, depends on the appointment.
Yes.
Yeah.
Of course, beside when Dr. Ginny is not here, there is another Dr. Saul here.
Yeah, I have in-house Dr. Saul with me here.
She will also well trained by Dr. Ginny as well. So means that if let's say your time is come to USJ Taipan and Dr. Ginny is not here, means that Dr. Saul is still equivalent as good. Or otherwise the trainer won't let the student out on. All right, so hope you guys have a really
miss out any question?
I hope I didn't miss out for private chat. Okay, I am Dr. Ginny patient, so she has my details. If I win, please let me know. All right,
okay,
Savita.
sure, Savita. Okay.
Yeah, so thank you so much. Can you hear us now, Savita? Is family planning such as IUD can cause pigmentation too?
Okay, IUD definitely won't cause pigment because IUD actually without any hormone, unless you are using Mirena. So if you are having like heavy menses, then some ONG doctors, obstetric and gynecologists, actually they will prescribe Mirena. So Mirena actually have hormone. So Mirena can have the pigment risk. But IUD per se with the copper, it is using copper. The copper ingredient actually won't cause any like pigment formation.
Yeah, Dr. Ginny, besides as a skin specialist, she also good in what?
I actually have 4 years training in ONG. I actually halfway specialize in ONG, but then I don't like the lifestyle of ONG specialists. So I already halfway specialized in ONG and then I give up. Then I join aesthetic because I prefer the lifestyle of aesthetic. I go home 6:30 and then I no need to
24 hours on
yes,
call.
I need
Dr.
to
Ginny, the patient is delivered, come back to office now.
Exactly, yes. So 12 midnight I need to do cesarean section. 2 a.m. I need to do cesarean section. Oh, I suffer 4 years in ONG actually.
Okay, so that's why you guys know why she knows so much of hormones, pigmentations, and
I know women's.
no, so that's why I choose the right doctor for you guys, you see. Then, okay, so hope that we have answered most of the questions here.
I think almost all already. Okay lah.
Right?
Yeah.
So we are over time, we are over time. Supposed to be 45 minutes. We have overtime for 30 minutes.
Oh really?
Yes.
Okay,
Okay, seriously, I think Dr. Ginny very hungry now already.
You are the one who hungry. You say I'm hungry.
So thank you so much for your time, and for those friends who are here, seriously appreciated that. Another 2 weeks, we will talk about deep pigmentation.
Yes.
Stay tuned. Deep pigmentation. If you think that you have more questions to ask regarding about how to treat pigmentation, like Bimi, I know you are very concerned about scarring and acne scarring. I did tell Dr. Ginny just now, so she already put into her slides as well.
Yes.
But that one will be the
Third
section. Okay. This next session in 2 weeks also will be Wednesday or Thursday. It is either this timing. Yes, will be about 5 or 6 o'clock in this timing as well, right? So hopefully you guys enjoy the session. I enjoy so much. I get so much of information and free consultations or more.
Yeah, it's not so stressful only lah.
Right?
This life not too bad, not too bad.
Not too bad. So okay, seriously, thank you so much, and I see you guys again. Bye bye.
Bye bye.
Bye bye.